A mental health diagnosis is a careful and considered clinical evaluation. It is a process undertaken by a trained professional. The purpose is to understand the nature of a person's distress. Think of it not as a judgment, but as the creation of a map for a landscape that can feel confusing and overwhelming. This process matters immensely because a clear understanding is the very first step toward finding a path to relief and recovery. It helps to give a name to suffering, which can itself be a profound comfort. It allows clinicians to draw upon a body of scientific knowledge to guide treatment, offering strategies that have helped others who have walked a similar path. Without this initial step, treatment would be guesswork. A ship sailing without a compass. The central idea to hold on to is that a diagnosis is a tool, not a label that defines a person's entire being. The diagnostic journey almost always begins with a conversation. A clinical interview forms the very foundation of understanding. This initial meeting is a space for the patient to share their story with a clinician, perhaps a psychiatrist, a psychologist, a clinical social worker, a licensed therapist. The clinician's primary role at this stage is to listen with focused, compassionate attention. They will ask open-ended questions about the person's thoughts, their deepest feelings, and the behaviors that are causing them or others concern. They will inquire about the history of these difficulties, when they first began, and how they have evolved over time, a process that is as much an art as it is a science. This initial discussion goes far beyond immediate symptoms. The clinician will gently explore many areas of the person's life to build a complete, holistic picture. They will likely ask about your sleep patterns, your appetite, and your energy levels. Your medical history and any current physical health problems are crucial. So is your family's history of medical conditions and of psychiatric conditions. The clinician will ask about your life at work, at school, and in your relationships to understand how struggles affect functioning and connection. To bring structure and consistency to the diagnostic process, clinicians rely on a set of specialized tools. Chief among these are diagnostic manuals, which serve as comprehensive guides. The two most widely used manuals in the world are the Diagnostic and Statistical Manual of Mental Disorders, currently in its 5th edition, and the International Classification of Diseases, 11th revision. These books are not cookbooks with rigid recipes, but rather detailed reference guides that list specific criteria for different conditions. They provide a common language for clinicians, researchers, and public health officials, ensuring that a diagnosis of major depressive disorder in one clinic means roughly the same thing as it does in another. These manuals are the products of decades of research and collaboration among thousands of experts from around the globe. For each condition, they outline the key symptoms, specify how many symptoms must be present, and define the minimum duration for which they must have occurred. For example, a diagnosis of major depression requires the presence of at least 5 specific symptoms over the same 2-week period. These criteria help the clinician move from a general impression to a more specific and structured conclusion. It is important to remember, however, that these are guides. A skilled clinician always uses their clinical judgment to interpret the criteria in the context of the individual's unique life and circumstances. A mental health diagnosis rests on 3 fundamental pillars: symptoms, time, impact on daily functioning. The first pillar, symptoms, involves identifying the specific thoughts, feelings, and behaviors that are causing distress. It is not enough to say one feels bad. The clinician needs to know the texture of that feeling. Is it a persistent sadness or loss of pleasure, characteristic of depression, or is it overwhelming worry or physical tension, more typical of an anxiety disorder? The number and combination of symptoms are critical. Diagnostic manuals list specific clusters that tend to occur together and define a particular condition. The second pillar is time, duration, and persistence of symptoms. A fleeting moment of sadness after a disappointment is a normal part of the human experience. It is not a clinical depression. For a diagnosis to be considered, the symptoms must be present for a specified minimum period. For major depression, this is at least 2 weeks. For generalized anxiety disorder, it is excessive worry occurring more days than not for at least 6 months. This time element is crucial because it helps to separate a transient emotional reaction from a more persistent and ingrained pattern that constitutes a clinical disorder. Perhaps the most critical pillar is functional impairment. This refers to the degree to which the symptoms interfere with and disrupt a person's life. A crucial and often overlooked step in the diagnostic process is what clinicians call differential diagnosis. This is the methodical process of ruling out other possible causes for the symptoms a person is experiencing. Many different conditions, both medical and psychiatric, can present with similar signs. It is the clinician's job to act as a detective, carefully considering and eliminating these mimics before settling on a final diagnosis. This step is absolutely essential for ensuring that the diagnosis is accurate and that the subsequent treatment is appropriate and safe. It is a testament to the complexity of the mind-body connection. For example, many symptoms commonly associated with mental health disorders, such as fatigue, changes in appetite, cognitive fogginess, low mood, can also be caused by underlying medical conditions. A person presenting with these symptoms could have depression, but they could also have underactive thyroid anemia, vitamin deficiency, multiple sclerosis. Therefore, a responsible clinician will often recommend or conduct a physical examination and basic lab work, such as blood tests, to rule out these medical possibilities. Mistaking a thyroid problem for depression would lead to incorrect treatment and prolonged suffering. While the diagnostic process is guided by science and structure, it is not without its significant challenges. One of the most fundamental complexities is the subjective nature of the experience itself. Unlike a broken bone that can be seen on an X-ray, mental health conditions are defined by internal states, thoughts, and feelings. People describe pain differently and clinicians interpret those descriptions differently. Stigma can cause people to downplay symptoms or avoid seeking help, preventing the conversations needed for healing. Cultural differences shape how distress is expressed, sometimes through physical symptoms, and what is seen as normal grief versus disorder. One promising shift is toward a dimensional approach, viewing symptoms on a spectrum rather than rigid categories. Researchers are also exploring biomarkers, patterns in brain scans or in the blood, that could one day aid diagnosis. These advances may complement but never replace the essential human act of listening. In the end, the process of receiving a mental health diagnosis should be seen as an act of hope. It is a structured and compassionate effort to bring clarity to confusion, to give a name to a difficult experience, and to light a path toward effective treatment. The journey involves listening to a person's story, considering symptoms over time, and assessing the impact on their life. It thoughtfully rules out other potential causes. Remember, a diagnosis is a guide, not a final destination. It provides a map toward therapies, medications, and support systems. Early, accurate diagnosis often leads to better outcomes. A diagnosis does not define you. You are more than symptoms, a whole person with strengths, passions, relationships, and a story still being written. There is help. There is profound hope for recovery. A diagnosis is not a life sentence. It is the start of a more hopeful conversation about what comes next.